Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, today we are being joined by Dr. Anant Joshi. Dr. Anant Joshi, one of the pioneers in arthroscopy and sports medicine. Dr. Joshi brings in 30 years of experience in this field. He travels and operates across the length and breadth of India and has been associated with numerous sports bodies as a medical consultant. He is well known as Sachin Tendulkar's doctor and is a consultant to the BCCI on sporting injuries. He is expert in ankle, shoulder and knee problems. Well, he is also the director of SPORTSMED, the Sports Medicine Institute, known all across the country. So, let's hear in from the man himself more about sports medicine. Well, thank you so much, Dr. Anant Joshi, for joining to Good Life, the health show. So, if you want to know about what exactly is sports medicine, what would you like to tell?
So, for most people, when they look at sports medicine just as two words, they are under the impression that the therapist who rushes to the sports field or the doctor who treats a sportsman is a sports medicine doctor.
Okay.
But if you look at the broader sense, it should be called sports or exercise medicine. And doctors who tend to use either exercise or sports as a form of therapy rather than prescribing medicines are sports medicine doctors. So very often patients who come to my clinic with say backache or knee problems or ankle problems, I tend to emphasize more on lifestyle changes and exercise or sports rather than prescribe a long list of medicines which is normally done. And I think that is the big difference between a sports medicine practitioner versus an ordinary or a regular physician. Now, the other thing of a sports medicine is not just treating sports or exercise related injuries. You also need to look at the fitness of an individual. So, it takes into account fitness evaluation. If you have a person who wants to gain weight, gain muscle or lose weight, you should be able to prescribe an exercise for that particular individual and then manage issues arising out of exercise. For example, when you talk about exercise or sports, it is basically challenging your physical, physiological and mental systems. Because you want to try to be better and better in whatever you are doing. And in that, there is always an element of overload on your systems, and this leads to injuries. These injuries could be minor or like an ankle sprain, or they could be serious injuries like an injury sustained by a footballer when he is tackled. So you have a wide spectrum of injuries, you need to treat those. And the final part about it is also getting these people back into the playing field,
Back into the form.
as much as they could originally do. So that is the rehabilitation part. So sports medicine is a wide spectrum.
Wide spectrum.
Right from diagnosis to exercise prescription to managing injuries to rehabbing. Today, when we talk about sports medicine, we talk about the nutritional aspects, the psychological aspects of a sportsman. So all these are under the umbrella of sports medicine.
So it's a teamwork, it's everything which is related and what it comes out as sports medicine. So what is your mantra, doctor? Therapy or medicines?
So I don't believe in medicines at all because I feel that all medicines are chemicals which can adversely affect your bodies. Medicines have effects, but they also have side effects. So I think people pop in painkillers when they have no pain. Now what is that painkiller going to kill? It's killing the patient, not the pain. So I think this habit of people going to a doctor expecting to have a long list of medicines as therapy rather than trying to change their lifestyles is what is going to cause more problems to people than simple things like taking to exercise or changing your lifestyle. I think that is the key. And my mantra is don't take medicines, exercise more, change your lifestyle.
Now, this is also kind of a psychological problem as well. Like if you go to a doctor and you get a long list of medicines, so you'll be cured easily. So, do you think so as well?
There are two sides to the coin. Patients are not happy if doctors don't write medicines.
Absolutely.
So, and doctors are only too glad very often to prescribe medicines. But I think for somebody who is wanting to treat medicine or practice medicine from the clinical sense, I think it is very important to treat the patient not just from the focus on the disease that he has, but also look at the lifestyle, whether some of the lifestyle issues have caused this disease and whether that can be rectified, then just focus on one particular issue.
Okay. Now, Doctor, as you are the director of SPORTSMED, the Sports Medicine Institute known across the country. Now, tell us something about that SPORTSMED as well.
So, SPORTSMED Mumbai has been my real dream project.
Okay.
I started practicing sports medicines in 1984 when I returned from the US with a degree in sports medicine. But the whole concept of sports medicine was still in a limbo because I could not have a team of doctors and we could not have an integrated sports medicine services.
Okay.
For example, if a patient comes to you and he needs an X-ray, then you send him somewhere else for an X-ray. Then he comes back, you need to show him physiotherapy, he goes somewhere else for physiotherapy. I wanted to set up a clinic where it would be integrated. Okay. So if a patient comes to me and I need an X-ray, which is very important because, you know, very often most of the sports related injuries are to muscles, bones, joints. Now, so you need X-rays, you need MRIs, you need CT scans. And patients very often are reluctant to go elsewhere, come back. It's a lot of waste of time for patients also. So under one roof, we have imaging services which work very closely with the orthopedic surgeons who are the primary doctors for diagnosis. The radiological services not only do imaging, that means take X-rays, MRIs, but they also do intervention. For example, very often when people have shoulder pain, there is a procedure called ultrasound guided injection which can relieve them of the pain and then make sure that physiotherapy becomes better. So I have got a full-fledged musculoskeletal unit working at SPORTSMED. Then you also need a physiotherapy backup because not all patients who come to us are advised surgery. Very often they are advised exercises.
Therapy,
and so,
physiotherapy.
Absolutely. And if your physiotherapist is on the same wavelength as you, then it makes life simple. So that is why I have a full-fledged physiotherapy setup. We have an operation theatre, we have surgeons who specialize in backs, ankles and foot, shoulder and elbow. So we have super specialized surgeons working together. We have musculoskeletal imaging, we have in-house surgical setup, and we have physiotherapy. We also have osteopaths, which is again something of a rarity in India. Osteopathy is something similar to chiropractor, but they look more from the alignment of the body, and I think that is also critical in our setup.
Okay, so a lot of things and a lot of like equipments, and the technology has been growing so fast that these things are very much important for the patients who come up to your hospitals as well to get themselves treated. Now, doctor, if you want to ask about like how can sports persons like avoid injuring themselves, like what do you want to tell on that?
I think when you enter the sports field or when you are exercising, like I said earlier, if you are trying to do your best, injury is a part and parcel of sports. So you cannot avoid injuries. How to minimize them? Is the key. And minimize means that you need to be prepared for the sport that you are playing. So suppose I am playing cricket, for example, if I am a cricketer, I need to find out, and if I am a pace bowler, I need to find out what is the overload for a pace bowler, what are the areas which are likely to be injured, address those areas, Find out what are my strengths and weaknesses. For example, I may be very strong, but I may not be flexible at all. So I am stiff. And that stiffness can lead to an injury. So I need to work on my
So
stiffness.
things has to be ruled out actually.
So you need to basically evaluate a person, find out his strengths and weaknesses and address them. And that is the way by which you can prevent a lot of injuries. The other thing, like I said earlier, is that you always overload your system. And there is a fine line between overloading and going beyond the limit where you'll end up with an injury. So I always tell people, listen to your body. Don't listen to your trainer. So your body is constantly telling you, is this enough? And when your body tells you it is enough, you should stop.
The capacity of your body is very important.
Yes, because I think so body awareness is very important to prevent an injury. Today you see people running on the treadmill. They are completely distracted by their telephones, or they are watching a TV or watching news, and their body is working on the treadmill.
Hearing loud
Now
music.
they are completely distracted. They are not knowing what is happening to their muscles, what is happening to their joints while they are exercising. So I think that is the key. When you are doing any form of exercise, you need to be in that moment. You should not be thinking of somewhere else and getting distracted.
The full concentration has to be at what exactly your body is going through.
Absolutely. So I, like a madman, was using a GoPro while cycling, and sure enough I crashed and I had a fracture. So I got distracted. So I need to put into practice what I preach. So I think these are the key things: body awareness, being in the moment, and seeing how what is your joint doing. Is your some muscle paining? Is some joint doing giving you pain? So these are feedback mechanisms which tell you whether you can be injury free or not.
Okay. It's time now to slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You are still watching Good Life, the health show with me, Pooja. Now, doctor, if we talk about the knee injury, now what to do if knee injury occurs? Like,
I think the knee is the most exposed joint. It is the most mobile joint, but unfortunately it is also a joint which is very vulnerable to injuries because it is not stable like a ball and socket joint. So you can have acute injuries, like you can be tackled, you can be pushed, you can fall on the ground, and these are injuries which are a part of contact sports very often. There are other kinds of injuries which are predominantly because of overuse. So if you are a marathon runner and if you keep on running, your body is getting repetitive micro injury to the joint. So I think what you need to have is a balanced exercise program to prevent these overuse injuries. Whenever you have an injury, it is a good idea not to brush it under the carpet, but to get a diagnosis. Because if the injury is simple, you can get away with just some physiotherapy, some painkillers. But if your injury is something which is significant, for example, we have seen players who keep on falling after a football injury, and they try to take it in their stride and say that it was a sprained knee. But actually they have the commonest injury that we see in a knee in a footballer is the anterior cruciate ligament injury. And if these players keep on playing on this injured knee, they damage it significantly, and very often when they come too late to us, we can do very little to rectify it completely. So I think diagnosis of an injury of any kind is critical.
Is critical. So when the diagnosis is done, so the treatment starts as well, of course. So how long do you prescribe the person to take rest or have to avoid things which he has been doing regularly in his lifestyle?
It all depends on the severity of the injury.
Okay.
So there could be players who can go back within a week, 2 weeks. There are some who require a lot. For example, very often after the Mumbai Marathon, we see people who have not trained adequately, who go out and run the entire marathon and come back with severe bone swelling. Now these are kind of stress fractures, and these people will take at least a minimum of 3 months to recover from these stress fractures. So, or if they have undergone some major surgery, it may take even 6 months to a year before they can return to sports.
So was it because the body didn't allow them to do, and they had done an aggressive running on that mode for any kind of like thing?
So stress fractures very often will happen when your body is under conditioned to do a particular activity. So if you are a regular athlete and you have been increasing your mileage progressively, then most things are under control. But very often you find that people have deficiencies like vitamin D deficiency, calcium deficiencies. Their style of running is not right. And because of that also they can land up with injuries.
Okay. Now doctor, like how do you create awareness about sports injuries in India? Like what is the procedure? How do you create awareness?
I think programs like these,
Okay.
where you have people coming and talking to the audience about how to prevent injuries, I think that can go a long way. I think the press has been playing a very important role today in carrying out a lot of articles, not only from India but overseas as well. So prior to the Mumbai Marathon, in fact almost for 6 months before that, they'll have articles from different people on how to start training. I think that will definitely help in people also take towards exercise and also prevent a lot of injuries.
Okay. Now doctor, what is the outlook for sports and healthcare support structure of people of Northeast if we talk on?
I think the Northeast has made a mark in sports today. In all disciplines of sports, you find that there are people from the Northeast who are playing a major role. And I think a hospital like here, like Chorus, which is being started, and you have specialists coming from all over the country, I think will go a long way in helping the athletes of the Northeast in managing their injuries. You also need more and more institutions like these, because Northeast after all is a
sports hub, you can say.
Absolutely. So just one center is not going to be enough. You need to have centers for sports training, for rehabilitation,
and proper
from
guidance
injury
is very
management.
important.
Absolutely.
Now we have also learned, doctor, that you have traveled like and operated across the length and breadth of the country. Now what is the journey behind, and like what was the challenge that you have faced? You would like to share anything with us at this point in time?
So during the first 30 years of my practice, I used to practice in Mumbai, and then for every weekend I used to be traveling to different cities in India and operate. And the main reason for this was that the facility for arthroscopy was not available in majority of the places. And so it was a kind of a service which was made available to people.
Okay.
So I used to travel to, I think, 10 or 15 cities all over the country and operate. There was another reason for it. I am a foodie. And I like to try food from
different
all
cuisines of different places.
And in India, you know, you go from one state to the other and there's different kind of food. So as a foodie, I love to travel and so not only operate but also enjoy the local delicacies.
Absolutely. Now, Doctor, this question is very important. Of course, the viewers who are watching us will be knowing a different side of yours as well. Like you have been like associated with different sports personalities as well. Like you have been, what we have heard is like Sachin Tendulkar as a consultant. Like, so tell us something about that experience as well, and also about the other sports personalities as well.
So, when you're playing at a level of sport that Sachin played, or maybe PT Usha played, or Dhanraj Pillai played, I think the player themselves are so mentally strong that the doctor's role is very little. It is more supportive.
Okay.
And you know, a lot of these players are not playing only because of the injury. They are purely playing on their adrenaline and the motivation that they have. So it is incredible to watch these people from close quarters, that the kind of strength that they have, the kind of pain that they can take, and the motivation that they have. So most of these players whom I have treated at the top level, I think what you need to learn from them is their motivation, dedication to sport, and their passion for sport. And that is what I learn when I get close to these people.
So you had an experience which you will be, of course, remembering in your life anytime, wherever you go, anywhere. And of course, you will be sharing with us when we take your interviews as well, as isn't it? Now, Doctor, you are yourself an avid sportsman, and we have heard that you often cycle to work. Now, is it your passion, or you would also like the viewers who are watching our show, the bit of suggestions you wouldn't give to them as well?
So I was not a cyclist to begin with. I represented Maharashtra and Bombay University in badminton, and in fact won the All India Intermediate 4 times. And then even during my medical college days, I played, and I then gradually switched to tennis.
Okay.
But then my knees packed up, and because of overuse and abuse, and that is when I took to cycling. So the lesson to be learned here is that you should adapt to what your body is telling you.
Okay.
I need my knees for my surgical work, so I need to conserve my knees. So the best form of exercise to conserve knees whenever you have pain in the knee is to do low impact exercise like cycling and swimming.
Okay.
So I have taken to cycling as a passion now, and at least I have 2 trips every year which are 500 kilometers plus.
Okay.
And I tend to use cycling as my vehicle in Mumbai. I don't like to use the motor car as far as possible. So cycling is my primary way of commuting in Mumbai.
And also to lessen the pollution as well. So it's a good thing which you have been
Absolutely.
doing. Now, Doctor, we are really short of time. So what tips you want to give to our viewers who are watching our show? Especially to the sportsmanship and sports persons who are watching our show.
No, I think stay healthy.
Stay healthy.
The main thing is that your body is a gift, and you need to preserve it, maintain it, build up on it, and balanced exercise. So don't concentrate on just one form of exercise. Use different body parts so that one body part is not overused and you don't land up with injuries. In my own lifestyle, I have incorporated cycling. I do yoga about twice or thrice in a week, and I do weight training 3 to 4 times a week. So a balanced exercise is what helps you. It will not increase the the length of your life, but it will definitely give you a better quality of life.
All right. Thank you so much, Doctor, for giving us those valuable suggestions at this point in time and giving your wonderful time for us. And those suggestions, of course, the viewers who have watched our show must be benefited. Thank you so much, Doctor.
Thank you.
And that's all we have for you in this episode of Good Life, the Health Show. Keep watching Northeast Live. Goodbye and take care.